Hi everyone, welcome back to my channel. Hope you're well wherever you are watching from. If you are new here, my name is Carol and I'm a licensed occupational therapist. Babies are born with several involuntary movements that happens either spontaneously or as response to different actions. These involuntary movements are called reflexes. Reflexes may be strong in some babies and may be weak in others depending on several factors, which may include how early the baby is born before its due date. In today's video, we'll talk about the sucking reflex in particular. The sucking reflex happens when the roof of a baby's mouth is touched. When this area is stimulated, the baby begins to suck. The sucking reflex begins developing as early as 32nd week of pregnancy and is generally fully developed by 36th week of pregnancy. If you have been pregnant before, you might have seen this reflex in action during a routine ultrasound, whereby some babies are seen sucking their thumb or hand, showing that this reflex is developing. Prematurely born babies may not have strong sucking reflexes at birth and may not have the endurance to complete a feeding session. They will be assisted to get nutrients via a feeding tube that is inserted through the nose into the stomach. It may also take the intervention of an occupational therapist to help the baby learn to coordinate both sucking and swallowing. An occupational therapist will test the baby's reflex by placing a bottle, a pacifier, or a clean finger inside the baby's mouth. If the reflex has fully developed, the baby places their lips around the item and rhythmically squeezes it between their tongue and palate. Breathing and swallowing can be a very difficult combination for premature babies or even some newborns. So if you suspect any issue with your baby's sucking reflex, talk to your health service provider who will give you appropriate referral or intervention, since this reflex is important for feeding, and any malfunction can lead to malnutrition. The baby shown in this video was deprived of oxygen during the birth process and was unable to sustain adequate spontaneous respiration upon delivery. He had persistent Apgar score of 3 up to the 4th minute. This may have resulted to a neurological injury. As a result, he has a weak sucking reflex and very low endurance to feeding. Sucking reflex should be present in all neurologically normal infants. Thank you so much for watching. If you liked the video, click the share button, click the like button and subscribe.